proposed to do with this new project to the Peterson Foundation. It grew out of an effort to deal with America's long-term debt projections because of the aging of the population and the explosion of healthcare costs. We've now had 4 years in a row for the first time in half a century when inflation and healthcare costs were 4% or less. Nobody really knows whether it's sustainable or not. Because we haven't, to go back to the professor's comment, we haven't made a decision yet to fully change the delivery system. So what are you going to try to do to get good outcomes out of all this stuff that's happening?
Okay, well, thank you. Well, we started the Peterson Center on Healthcare just about a month and a half ago. And the reason we set up a separate and distinct entity within our foundation is that healthcare represents a very different challenge from all the other fiscal challenges. So you can solve Social Security in Washington with a piece of legislation. You can deal with tax reform. You can modify the defense budget, whatever you want to do. Those are all within Congress's control. Healthcare, on the other hand, is not entirely. There's a lot you can do with health policy, but this is a private healthcare system, and you can't pass a piece of legislation that increases efficiency in the healthcare system. Secondly, healthcare is not just a fiscal challenge, it's a major economic challenge. And to me, it's one of our greatest economic challenges and opportunities. As you said earlier, right now we spend about 17.5% of the GDP on healthcare. The average OECD country spends about 9.5% of GDP. So that's a huge amount of waste. We did a study with the Institute of Medicine that showed that there's $800 billion of annual waste in the healthcare system alone. And so we're not achieving better outcomes at all, but we're spending much more of our economy. And no matter what you care about within our economy, it affects it. So it affects our competitiveness because it's a huge burden on all our corporations. As you said earlier, it's a wage issue. Many of us are focused on income mobility and opportunity and inequality of incomes. Compensation has been increasing, total compensation including benefits, but because of the increases in healthcare costs, there's been less and less available to increase take-home pay. It's also a huge factor for our investment in our future, right? As you were saying, there's crowding out that's going to happen in the federal budget and the state and local level with the increases in healthcare spending that we've been seeing. For example, the waste alone, that $800 billion, that's equivalent to the entire nation's K through 12 education budget, okay? So the waste alone in healthcare is equivalent to the total spend on education. So if you're focused on education, you need to be focused on healthcare. So for all these reasons, we decided to set up a separate and distinct entity focused on driving better performance. And what we mean by that is better outcomes at lower costs. And this is where I think we have a tremendous opportunity here. There are countries around the world who are doing this already, but more importantly, there's practices within the United States that are delivering much better health care at much lower costs. As Jeff said earlier, we've gone around the country and found these primary care practices that are achieving much better performance. So what we see the role of our new center is to be the spreader and scaler. When we first started, we were wondering, do we have to invent new methods of care? Are we going to have to do pilot projects? And I was delighted to learn that no, it already exists. But there wasn't another organization that existed that was really working on three things: finding these methods, validating them with real results, and then focusing on replicating them around the country. So that's the role that we see that we can play in helping the system improve its performance.
I want to give